Monkeypox, which is usually mild but can kill, has been endemic in parts of Africa for decades. A new strain, however, appears to spread more easily through routine close contact. According to the Africa Centers for Disease Control and Prevention, over 15,000 Mpox cases and 461 deaths were reported on the continent this year so far. That's a 160% increase from the same period last year. A total of 18 countries have reported cases.
Mpox has been reported in the Democratic Republic of the Congo for more than a decade, and the number of cases reported each year has increased steadily over that period. Last year, reported cases increased significantly, and already the number of cases reported so far this year has exceeded last year's total, with more than 14,000 cases and 524 deaths. As many of you who tune into our regular press conferences know, WHO has been working on the Mpox outbreak in Africa and raising the alarm that this is something that should concern us all. Last week, I announced that I was convening an emergency committee under the international health regulations to evaluate the upsurge of Mpox in the Democratic Republic of the Congo and other countries in Africa. Today, the emergency committee met and advised me that, in its view, the situation constitutes a public health emergency of international concern. I have accepted that advice. The detection and rapid spread of a new clade of Mpox in eastern DRC, its detection in neighboring countries that had not previously reported Mpox, and the potential for further spread within Africa and beyond is very worrying. In addition to other outbreaks of other clades of Mpox in other parts of Africa, it's clear that a coordinated international response is essential to stop these outbreaks and save lives. A public health emergency of international concern is the highest level of alarm under international health law. The emergency committee's advice to me and that of the African CDC Centers for Disease Control and Prevention, which yesterday declared a public health emergency of regional security, are aligned. WHO is on the ground, working with the affected countries and others at risk through our country and regional offices, as well as with partners including the Africa CDC, NGOs, civil society, and more. For example, we're providing missions to analyze blood samples and confirm cases of Mpox. We're supporting laboratories to sequence viral samples. We're on the ground supporting case investigation and contact tracing, risk communication, and community engagement. We're training health workers and supporting clinicians to provide appropriate care. We're supporting countries to access vaccines and develop the strategies to roll them out, and much more. To fund this work, WHO has developed a regional response plan requiring an initial $15 million. We have released about $1.5 million from the WHO Contingency Fund for Emergencies, and we plan to release more in the coming days. We're also appealing to donors to fund the rest of the response plan. WHO is committed in the days and weeks ahead to coordinate the global response, working closely with each of the affected countries and leveraging our on-the-ground presence to prevent transmission, treat those infected, and save lives.
The evidence we have on the number of cases, the number of deaths, they are just the tip of the iceberg. And the reason is that Mpox is largely a mild condition. We have limited surveillance. We have limited capacity to do the testing that's required. We have limited capacity to do the contact tracing and the reporting. So they are at multiple points in this. The information we have reflects only a partial situation of what's actually happening. So that means that even though the situation and the evidence we had showed that the problem was quite severe, it's in reality probably even more so given the limitations we have. Africa is currently in a situation where there's a high burden of cases. There are far more cases now than there were when the WHO declared a public health emergency of international concern in 2022. In fact, if you look at the period, the most recent period, the number of cases in Africa is more than triple what it was when the FEAC was declared in 2022. So it's very clear that we are now dealing with a different situation, a situation where the cases are far more than we've seen in the past year and in the past 2 years. So we have a high burden of cases.
This is not just an African issue. Mpox is a global threat, a menace that knows no boundaries, no race, no creed. It is a virus that exploits our vulnerabilities, preying on our weakest point. And it is in this moment of vulnerability that we must find our greatest strength and demonstrate that we are all learning from the COVID lesson and we are playing solidarity.